Hello everyone, I am Dr. Suman Pawar, working as an assistant professor in Department of Zoology at Dada Patel Mahavidyalaya, Karjat, District Ahmednagar. Friends, today I am with you with a new video, but this video is for educational purpose only. No copyright infringement. This copyright belongs to its rightful owner. Credit goes to the respective image and content providers. Today, we are discussing about the venous system in Calotes versicolor. The venous system is the system through which the deoxygenated blood from different parts of the body is brought back to the heart by means of veins, except the pulmonary veins which carries oxygenated blood from the lungs. The veins are those blood vessels which runs parallel to the arteries. They appear dark in color and they locate superficial in position to the arteries. The venous system in Calotes, by which the blood is returned to the heart by a small common pulmonary vein from the lungs, as it is the oxygenated blood, and by three large veins, the right and the left precavals and a postcaval vein which collects the deoxygenated blood from the entire body organs of Calotes. Let us see one by one. The first one, the common pulmonary vein. It is formed by union of right and the left pulmonary vein, and that brings blood from the right and the left lung and opens into the left auricle. Though it is the vein, but it brings oxygenated blood, hence it differs from all other veins. This is the venous system of Calotes. Now see, these two are the precavals. This is the right precaval, here is the left precaval. Each precaval is formed by three subveins. See, this internal one, it is the internal jugular, here is the external jugular, and here is the subclavian. Means this internal jugular, external jugular, and this subclavian, all these three joints from each side, and they forms the precaval vein of their side. Thus, the left as well as the right precaval veins are formed. The right precaval vein receives a special vein, that is azagus vein, which carries blood. The azagus vein, it carries blood from the ventral thoracic wall of Calotes. Here is the postcaval. This postcaval, it runs anteriorly, joins with the right precaval, and thus it forms the sinus venosus. Each precaval vein, it is formed by the internal jugular, the external jugular, and the subclavian vein of its side. Thus, these two precaval veins and one postcaval vein collects all the deoxygenated or the venous blood from their respective body organs and finally discharge into the sinus venosus, which is the main collecting chamber. The precaval veins, two precaval veins, namely the left and the right precavals, brings deoxygenated blood from the head and the forelimb region and thus drains it into the sinus venosus, from where it passes into the heart. Each precaval vein is formed by union of three veins, namely the external jugular vein, the internal jugular vein, and the subclavian vein. The right precaval vein receives a special vein, that is azagous vein, collecting blood from the ventral thoracic wall. The postcaval vein, this is the larger vein which pours its blood into the sinus venosus of the heart from the lower side. It originates posteriorly, that is, it arises posteriorly from the paired left and the right efferent renal veins, which runs forward along the inner sides of their respective kidney and joins each other to form the postcaval vein. The postcaval vein passes forward through the right lobe of liver and receives different veins like one or two vertebral veins which collects blood from their respective vertebral region, several hepatic veins from the left and the right lobes of liver which collects blood from the liver region, the esophageal vein which collects blood from the esophagus. The postcaval vein becomes large after emerging from the liver lobe, and finally it opens into the sinus venosus. The renal portal vein. The median caudal vein carries blood from the tail region, and the caudal vein bifurcates into two veins entering into their respective kidney and gives rise to the renal portal vein in its respective kidney. This renal portal vein receives the pelvic vein which carries blood from the hind limb through femoral and the sciatic veins. The renal portal vein forms capillary network in its respective kidney for exchanging the materials. The pelvic veins unite to form a median epigastric or anterior abdominal vein which runs anteriorly, a short median vessel which runs forward on the ventral side and joins with the great hepatic portal vein in the left liver lobe. See here, this is the caudal vein which runs forwardly. It enters into the kidney and thus it shows a bifurcation in the form of two renal portal veins which runs or which enters in their respective kidney. After entering into their respective kidney, they bifurcate or they forms a capillary network within their entire kidney portion for exchanging the materials in between the blood and the renal cells. This renal portal vein, it receives this pelvic vein. This pelvic vein also receives the femoral vein and the sciatic vein, and one branch of the pelvic vein, it runs anteriorly, joins with its counterpart, and thus it forms a large stout vein by the name anterior abdominal vein or the epigastric vein, which runs anteriorly. Parallel to this vein, there is another vein which is formed by joining of different veins from the entire digestive tract, and after entering into the liver, it becomes the hepatic portal vein. After entering into the liver, the hepatic portal vein, it bifurcates and it forms capillary network within the liver lobe so that the materials from the blood can be exchanged with the hepatic cells. The hepatic portal vein is formed by the anterior and posterior intestinal veins, gastric and the lineogastric veins. The hepatic portal vein enters in the liver, breaks into capillaries where the blood from trunk region as well as the posterior body region is filtered and again poured into the postcaval through the hepatic veins. Thus, Animals having such a portal systems are always provided with double supply of blood, that is the arterial blood supply as well as the venous blood supply. So today we have learned about the venous system in Calotes. If you have any doubt or you have any question regarding the content of this video, you can email me on the given address. Thank you. Thank you for your patient listening. Let me declare that this video is for educational purpose only. No copyright infringement, and this copyright belongs to its rightful owner. Credit goes to the respective image and content providers. For more videos, kindly visit our YouTube channel, Rahit Knowledge Bank. Thank you once again.